Hi everyone, welcome back to my YouTube channel, and today we are going to talk about cervical vertebra. So let's start our topic with introduction. Cervical vertebra are the uppermost vertebra of vertebral column located in the neck region. There are seven cervical vertebra labeled C1 to C7, and they are specialized to support the head that allow a wide range of motion and protect the upper portion of the spinal cord and vertebral arteries. Cervical spine is the most flexible part of vertebral column that enable head rotation, flexion, extension, and lateral bending. Location and number of cervical vertebra. Cervical vertebra are located between the skull and thoracic vertebra. There are 7 cervical vertebra from C1 to C7. C1 is also called as atlas that support the skull and allow the nodding movements. C2, also called as axis, it allows rotation of the head. C3 to C6 are called typical cervical vertebra which share structural features. And then there is C7 that is also called as vertebra prominens, and it has a long palpable spinous process. General features of cervical vertebra. Cervical vertebra have unique characteristics compared to thoracic and lumbar vertebra. They include vertebral body, vertebral foramen, pedicles and laminae, spinous process and transverse process, and articular fascias. Now let's talk about these features one by one. So first part is vertebral body. It is small and oval shaped to reduce weight as the cervical spine supports less body weight. Its superior surface is concave and inferior surface is convex to facilitate movement. Second part of cervical vertebra is vertebral foramen. It is large and triangular that allow passage of cervical enlargement of spinal cord. Third is pedicles and laminae. The pedicles are short and project laterally, and then there are laminae that are narrow and that form posterior part of vertebral arch. Then there's spinous process that is bifid in C2 to C6 that provide increased surface area for muscle attachment. And C7 has a prominent long non-bifid spinous process that is easily felt at the base of the back. Then there's transverse process that is short and pierced by foramen transversum, which transfers the vertebral artery, vein, and sympathetic nerves, except for C7, which transmit only vein. The sixth part is articular fascias. They are superior fascias that face upward and backward, and then there are inferior fascias that face downward and forward that allow a high degree of movements. Special cervical vertebra. First is C1 that is called as atlas. It is ring-shaped vertebra without a body or spinous process. It consists of anterior and posterior arches with large lateral masses. It articulates with the occipital condyles, thus enabling nodding movement of the head. Second special cervical vertebra is C2 that is also called as axis. It features the odontoid process that is also called as dens that project upward to articulate with atlas. It allows rotational movements or no movements of the head. Then there is C7 that is also called as vertebra prominens. It has long prominent spinous process palpable under the skin. Its transverse foramina are smaller and do not transmit the vertebral arteries. Intervertebral disc of cervical region. Intervertebral discs are present between all cervical vertebrae except C1 and C2. They are thinner here than the other regions, which contribute to cervical spine high flexibility but also predispose it to disc-related injuries. Functions of cervical vertebra. First, it supports the head as it holds and stabilizes the skull. Second, protection of spinal cord and vessel as it safeguards the upper spinal cord and vertebral arteries within the vertebral canal. Third, facilitation of movement as it allows rotation, flexion, extension, and lateral bending of head and neck. Fourth is attachment point as it provides anchor sites for muscles and ligaments of neck, shoulder, and head. Curvature of cervical spine. Cervical region contribute to lordotic curvature of vertebral column, curving inward to help maintain balance and distribute forces efficiently. Clinical significance of cervical vertebra. First is cervical spondylosis, that is degeneration of intervertebral disc that cause neck pain and stiffness. Second is whiplash injury, that is caused by sudden hypertension, hyperextension, or hyperflexion of the neck, and it is often in car accident. Third is herniated disc, that is displacement of cervical disc that can compress spinal nerves, leading to neck and arm pain. Fourth significance is fracture, as C1 and C2 fractures, Jefferson fracture and Hangman's fracture, are severe due to proximity to the brainstem. And fifth significance is cervical stenosis, as narrowing of vertebral canal compress the spinal cord. Conclusion of this lecture video. Cervical vertebra, a specialized bone designed to support and move the head while protecting the spinal cord and blood vessels. Their small size, bifid spinous process, and transverse foramina distinguish them from other vertebrae. Understanding the anatomy is essential for medical professionals, as injuries in this region can have serious consequences. And this was all about cervical vertebra. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.